My name is Polina Guysinskaya, PGY2 at Florida Atlantic University Internal Medicine Residency Program, and I'll be presenting one bloody GOO. Gastric outlet obstruction, or GOO, typically presents with epigastric abdominal pain, postprandial emesis, usually due to mechanical obstruction. Common findings include benign etiologies, primarily a complication of peptic ulcer disease. Bezoars are defined as concentration of undigested or partially digested material in the GI tract. One of the most rare cases of GOO results from intragastric thrombus formation resulting in the bezoar. We present a rare case of GOO due to a massive blood clot formation secondary to an alcohol bleed. We had a 62-year-old female on anticoagulation present to our academic hospital with epigastric pain, nausea, and vomiting. She had an extensive workup, and ultimately gastroenterology was consulted for an upper endoscopy. On that endoscopy, they found a gray-brown clot of blood in the proximal stomach, obscuring most of the cardia and fundus. It was at least 4 centimeters big, and it was unamenable to lavage. There was no bright blood or source of bleeding identified. The clot was seen to be ball valving through the pylorus, possibly causing a temporary GOO. An attempt to disrupt the clot architecture by physical manipulation and aggressive irrigation was met with limited success. Here in figures 1 through 3, you see the massive gray-brown clot noted with the cardia and the fundus, and on retroflexion you see remnants of it as well. A bleeding source was not identified at the time of the first endoscopy due to clot debris obstructing adequate visualization of the mucosa. Following this endoscopy, the patient remained admitted for observation and stabilization. 2 days later, a repeat endoscopy shown in figure 4 revealed multiple small areas of erosion without stigmata or bleeding. Clot was no longer seen. The patient was able to resume a full liquid diet and their oral anticoagulation. So as seen here, the massive clot is first noted in the first endoscopy, with subsequent resolution in the repeat and ulcerations seen there. So GOO is actually a misnomer due to the fact that most cases are not actually due to isolated gastric pathology, but actually to duodenal or extraluminal processes. A variety of causes may result in a GOO, such as fibrosis, inflammation, infection, malignancy, or infiltrative disease. A blood bezoar as a cause of GOO is exceedingly rare, as high volume bleeds and a stasis of blood in the normally high mobile GI tract are needed in order for this to occur. Most high volume bleeds result in rapid digestion due to gut motility or hemodynamic instability in brisk cases. In the absence of melena or hemodynamic instability, it's difficult to suspect bleeding to be a cause of GOO.